A 58-year-old male with a history of hypertension and chronic kidney disease, CKD stage 3, is prescribed lisinopril. 2 days later, his labs show potassium of 5.8 MEq/L. Which is the nurse's priority action? A. Administer the next dose as scheduled. B. Notify the provider immediately. C. Encourage high potassium foods. D. Restrict fluid intake. Answer B. Notify the provider immediately. Rationale: ACE inhibitors like lisinopril can cause hyperkalemia, especially in CKD. A potassium of 5.8 is dangerous and requires prompt intervention to prevent arrhythmias. Question 2. A patient taking hydrochlorothiazide reports muscle weakness and palpitations. Which lab value would the nurse expect? A. Potassium 5.6 MEq/L. B. Sodium 150 mg/L. C. Potassium 2.9 mg/L. D. Calcium 7.5 mg/dL. Answer: C. Potassium 2.9 MEq/L. Rationale: thiazide diuretics cause hypokalemia, leading to muscle weakness and cardiac arrhythmias. Question 3. A patient on metoprolol develops a heart rate of 48 beats per minute. What is the nurse's best action? Give the medication with food. B. Hold the medication and notify the provider. C. Administer atropine immediately. D. Encourage ambulation. Answer: B. Hold the medication and notify the provider. Rationale: beta blockers lower heart rate. HR under 60 BPM is a hold parameter due to risk of symptomatic bradycardia. Question 4. A patient taking clonidine abruptly stops the medication. What is the most likely outcome? A. Severe hypotension. B. Rebound hypertension. C. Bradycardia. D. Hypoglycemia. Answer: B. Rebound hypertension. Rationale: sudden withdrawal of clonidine causes rebound hypertensive crisis due to sympathetic overactivity. Question 5. A patient on furosemide develops tinnitus. What should the nurse suspect? A. Hypokalemia. B. Ototoxicity. C. Hypernatremia. D. Nephrotoxicity. Answer: B. Ototoxicity. Rationale: loop diuretics like furosemide can cause ototoxicity, especially with rapid IV administration or high doses. Question 6. A patient taking losartan asks why potassium supplements were discontinued. What is the best response? A. The drug lowers potassium levels. B. It can increase potassium levels. C. It causes sodium loss. D. It prevents dehydration. Answer: B. It can increase potassium levels. Rationale: ARBs, like losartan, can cause hyperkalemia, so potassium supplements are often avoided. Question 7. A patient receiving IV nitroprusside suddenly becomes confused and develops metabolic acidosis. What is the priority concern? A. Hypoglycemia. B. Cyanide toxicity. C. Hyperkalemia. D. Fluid overload. Answer: B. Cyanide toxicity. Rationale: nitroprusside metabolism produces cyanide. Toxicity presents with confusion and metabolic acidosis. Question 8. A patient taking spironolactone should avoid which food? A. Apples. B. Bananas. C. Rice. D. Chicken. Answer: B. Bananas. Rationale: spironolactone is a potassium-sparing diuretic, increasing risk of hyperkalemia. Bananas are high in potassium. Question 9. A patient on amlodipine reports swollen ankles. What is the nurse's best interpretation? A. Allergic reaction. B. Expected side effect. C. Sign of heart failure. D. Renal failure. Answer. B. Expected side effect. Rationale. Calcium channel blockers commonly cause peripheral edema due to vasodilation, not fluid overload. Question 10. A patient taking propranolol reports shortness of breath. What is the nurse's priority assessment? A. Blood glucose. B. Lung sounds. C. Urine output. D. Temperature. Answer. B. Lung sounds. Rationale. Non-selective beta blockers like propranolol can cause bronchospasm, especially in asthma patients. Question 11. A 65-year-old patient with hypertension and type 2 diabetes is prescribed enalapril. Which finding requires immediate nursing intervention? A. Dry cough. B. Blood pressure 130 divided by 80 millimeters of mercury. C. Angioedema with facial swelling. D. Mild dizziness. Answer. C. Angioedema with facial swelling. Rationale. ACE inhibitors can cause life-threatening angioedema, leading to airway obstruction. This is an emergency. Question 12. A patient taking nifedipine reports headache and flushing shortly after administration. What is the best nursing response? A. Discontinue the medication immediately. B. Document as an expected effect. C. Administer an antihistamine. D. Check for infection. Answer B. Document as an expected effect. Rationale. Calcium channel blockers commonly cause vasodilation effects such as headache and flushing. Question 13. A patient on hydrochlorothiazide develops hyperglycemia. What is the mechanism? A. Increased insulin secretion. B. Decreased glucose absorption. C. Impaired insulin release. D. Increased glycogen storage. Answer. Impaired insulin release. Rationale. Thiazides can raise blood glucose by impairing insulin release and increasing insulin resistance. Question 14. A patient taking labetalol asks why both alpha and beta effects are important. What is the best explanation? A. It increases heart rate and constricts vessels. B. It decreases heart rate and causes vasodilation. C. It only affects kidney function. D. It reduces sodium excretion. Answer. B. It decreases heart rate and causes vasodilation. Rationale. Labetalol blocks beta receptors, decreases heart rate, and alpha-1 receptors, vasodilation, effectively lowering BP. Question 15. A patient receiving furosemide IV has a potassium level of 2.8 milliequivalents per liter. What is the priority nursing action? A. Continue infusion. B. Hold medication and notify provider. C. Encourage fluids. D. Administer calcium. Answer B. Hold medication and notify provider. Rationale. Severe hypokalemia, 2.8, increases risk of arrhythmias. Loop diuretics worsen potassium loss. Question 16. A patient on captopril develops a persistent cough. What is the most appropriate action? A. Stop the drug immediately. B. Switch to an ARB per provider order. C. Increase the dose. D. Add a diuretic. Answer B. Switch to an ARB per provider order. Rationale. ACE inhibitor cough is due to bradykinin accumulation. ARBs do not cause this effect. Question 17. A patient with asthma is prescribed propranolol. What should the nurse do? A. Administer as ordered. B. Clarify the prescription. C. Monitor potassium. D. Give with food. Answer. B. Clarify the prescription. Rationale. Non-selective beta blockers can trigger bronchospasm, making them unsafe in asthma. Question 18. A patient taking spironolactone develops gynecomastia. What is the cause? A. Sodium imbalance. B. Hormonal effects. C. Fluid retention. D. Calcium loss. Answer. B. Hormonal effects. Rationale. Spironolactone has anti-androgen effects, leading to gynecomastia in males. Question 19. A patient on nitroglycerin patch therapy should be instructed to A. Wear patch continuously. B. Remove patch at night. C. Apply multiple patches. D. Cut patch in half. Answer. B. Remove patch at night. Rationale. A nitrate-free interval prevents tolerance, ensuring continued effectiveness. Question 20. A patient taking hydralazine develops joint pain and fever. What should the nurse suspect? A. Infection. B. Lupus-like syndrome. C. Hyperkalemia. D. Renal failure. Rationale. Hydralazine can cause a drug-induced lupus-like syndrome, presenting with joint pain and fever. Question 21. A 72-year-old patient on multiple antihypertensives reports dizziness upon standing. Blood pressure drops from 140/85 millimeters of mercury supine to 110/70 millimeters of mercury standing. What is the nurse's priority intervention? A. Encourage rapid ambulation. B. Educate on slow position changes. C. Increase medication dose. D. Restrict fluids. Answer. B. Educate on slow position changes. Rationale. This is orthostatic hypotension, common with antihypertensives. Slow position changes reduce fall risk. Question 22. A patient taking atenolol presents with diaphoresis, confusion, and a blood glucose of 52 milligrams per deciliter. A. Atenolol causes hyperglycemia. B. Beta blockers mask hypoglycemia symptoms. Atenolol increases insulin release. D. This is unrelated to the medication. Answer. B. Beta blockers mask hypoglycemia symptoms. Rationale. Beta blockers can mask adrenergic symptoms, like tachycardia, delaying recognition of hypoglycemia. Question 23. A patient receiving IV labetalol for hypertensive crisis develops a BP of 88/56 millimeters mHg. What is the priority action? A. Continue infusion. B. Stop infusion immediately. C. Administer diuretic. D. Elevate head of bed. Answer. B. Stop infusion immediately. Rationale. This indicates excessive hypotension, requiring immediate discontinuation to prevent shock. Question 24. A patient on valsartan develops facial swelling and difficulty breathing. What is the nurse's priority action? A. Administer antihistamines. B. Stop medication and call rapid response. C. Document findings. D. Give next dose early. Answer. B. Stop medication and call rapid response. Rationale. ARBs can rarely cause angioedema, a life-threatening emergency affecting airway. Question 25. A patient taking furosemide has a magnesium level of 1.2 milligrams DLER. What complication is most likely? A. Seizures, B. Arrhythmias, C. Hyperglycemia, D. Hypertension. Answer: B. Arrhythmias. Rationale: loop diuretics cause hypomagnesemia, increasing risk for cardiac arrhythmias. Question 26. A patient is prescribed clonidine patch. Which instruction is most important? A. Apply heat over the patch. B. Change patch daily. C. Do not abruptly stop the medication. D. Place on lower extremities. Answer: C. Do not abruptly stop the medication. Rationale: abrupt withdrawal leads to rebound hypertension, which can be severe. Question 27. A patient on diltiazem has a PR interval prolongation on ECG. What should the nurse do? A. Continue medication. B. Hold medication and notify provider. C. Administer calcium. D. Encourage exercise. Answer: B. Hold medication and notify provider. Rationale: diltiazem slows AV conduction. PR prolongation may indicate heart block. Question 28. A patient taking hydrochlorothiazide reports photosensitivity. What is the best advice? A. Avoid all fluids. B. Use sunscreen and protective clothing. C. Stop medication immediately. D. Increase potassium intake. Answer: B. Use sunscreen and protective clothing. Rationale: thiazides can cause photosensitivity, increasing sunburn risk. Question 29. A patient on nitroprusside infusion requires which priority monitoring? A. Blood glucose. B. Continuous blood pressure. C. Urine ketones. D. Liver enzymes. Answer: B. Continuous blood pressure. Rationale: nitroprusside acts rapidly and can cause sudden severe hypertension, requiring continuous BP monitoring. Question 30. A patient taking eplerenone asks how it differs from spironolactone. What is the best response? It causes more hormonal side effects. B. It has less risk of gynecomastia. C. It lowers potassium levels. D. It increases sodium retention. Answer: B. It has less risk of gynecomastia. Rationale: eplerenone is more selective, causing fewer endocrine side effects compared to spironolactone. Question 31. A 60-year-old patient with hypertension is prescribed prazosin. After the first dose, the patient reports dizziness and nearly faints. What is the nurse's best interpretation? A. Drug toxicity. B. First dose phenomenon. C. Allergic reaction. D. Electrolyte imbalance. Answer: B. First dose phenomenon. Rationale: alpha-1 blockers like prazosin can cause severe orthostatic hypotension with the first dose, known as the first dose phenomenon. Question 32. A patient taking lisinopril and spironolactone concurrently is at highest risk for which complication? A. Hypokalemia. B. Hypernatremia. C. Hyperkalemia. D. Hypoglycemia. Answer: C. Hyperkalemia. Rationale: both ACE inhibitors and potassium-sparing diuretics increase potassium levels, significantly raising hyperkalemia risk. Question 33. A patient on metoprolol suddenly stops taking the medication. A. Severe hypotension. B. Rebound tachycardia and hypertension. C. Hyperkalemia. D. Bradycardia. Answer: B. Rebound tachycardia and hypertension. Rationale: abrupt beta blocker withdrawal leads to increased sympathetic activity, causing rebound effects. Question 34. A patient taking amlodipine develops gingival hyperplasia. What is the nurse's best action? A. Discontinue medication immediately. B. Encourage good oral hygiene. C. Administer antibiotics. D. Restrict calcium intake. Answer: B. Encourage good oral hygiene. Rationale: calcium channel blockers can cause gingival hyperplasia, managed with proper dental care. Question 35. A patient on furosemide reports weakness, and an ECG shows U waves. What electrolyte imbalance is suspected? A. Hyperkalemia. B. Hypokalemia. C. Hypercalcemia. D. Hyponatremia. Answer: B. Rationale: U waves on ECG are classic signs of hypokalemia, commonly caused by loop diuretics. Question 36. A patient taking clonidine reports dry mouth and sedation. What should the nurse do? A. Discontinue the drug. B. Reassure that these are common side effects. C. Administer IV fluids. D. Notify the provider immediately. Answer: B. Reassure that these are common side effects. Rationale: clonidine commonly causes dry mouth and sedation, which are expected and not dangerous. Question 37. A patient receiving nitroglycerin develops a severe headache. What is the nurse's best action? Answer: B. Administer prescribed analgesic. Rationale: headache is a common vasodilation effect of nitrates and is usually managed symptomatically. Question 38. A patient on propranolol has a blood glucose of 45 milligrams per deciliter but denies symptoms. What explains this? A. Drug-induced hyperglycemia. B. Masking of hypoglycemia symptoms. C. Increased insulin secretion. D. Reduced glucose metabolism. Answer: B. Masking of hypoglycemia symptoms. Rationale: beta blockers mask adrenergic warning signs, making hypoglycemia harder to detect. Question 39. A patient taking hydralazine develops tachycardia. What is the mechanism? A. Direct cardiac stimulation. B. Reflex sympathetic activation. C. Sodium retention. D. Increased vagal tone. Answer: B. Reflex sympathetic activation. Rationale: hydralazine causes vasodilation, triggering reflex tachycardia via sympathetic activation. Question 40. A patient on enalapril reports decreased urine output and rising creatinine. What is the priority concern? A. Expected effect. B. Acute kidney injury. C. Dehydration only. D. Hyperglycemia. Answer: B. Acute kidney injury. Rationale: ACE inhibitors can reduce renal perfusion, especially in renal artery stenosis, leading to acute kidney injury. Question 41. A 68-year-old patient on hydrochlorothiazide presents with confusion and serum sodium of 124 MEq/L. What is the nurse's priority action? Answer: B. Hold the medication and notify the provider. Rationale: thiazide diuretics can cause hyponatremia, which may lead to confusion and seizures. Sodium of 124 is critical. Question 42. A patient receiving IV nitroglycerin develops hypotension and bradycardia. What is the nurse's first action? A. Increase infusion rate. B. Stop or reduce infusion. C. Administer beta blocker. D. Elevate head of bed. Answer: B. Stop or reduce infusion. Rationale: nitroglycerin can cause severe hypotension. Immediate dose reduction or discontinuation is required. Question 43. A patient on spironolactone has peak T waves on ECG. What is the most likely cause? A. Hypokalemia. B. Hyperkalemia. C. Hypocalcemia. D. Hyponatremia. Answer B. Hyperkalemia. Rationale: spironolactone causes potassium retention. Peak T waves are classic for hyperkalemia. Question 44. A patient taking metoprolol reports fatigue and exercise intolerance. What is the best explanation? A. Increased cardiac output. B. Reduced heart rate and contractility. C. Fluid overload. D. Increased oxygen demand. Question 45. A patient prescribed losartan asks why it is safer than ACE inhibitors regarding cough. What is the best response? A. It increases bradykinin levels. B. It does not affect bradykinin. C. It blocks calcium channels. D. It increases potassium excretion. Answer: B. It does not affect bradykinin. Rationale: ARBs do not increase bradykinin, so they do not cause the dry cough seen with ACE inhibitors. Question 46. A patient on furosemide develops dehydration and hypotension. Which finding supports this? A. Weight gain. B. Decreased hematocrit. D. Bradycardia. Answer: increased BUN. Rationale: dehydration leads to hemoconcentration, causing elevated BUN levels. Question 47. A patient taking clonidine experiences severe rebound hypertension after missing doses. What is the mechanism? A. Increased parasympathetic activity. B. Sudden sympathetic overactivity. C. Decreased norepinephrine. D. Sodium loss. Answer: B. Sudden sympathetic overactivity. Rationale: clonidine suppresses sympathetic output. Abrupt withdrawal causes rebound sympathetic surge. Question 48. A patient receiving diltiazem has a heart rate of 52 beats per minute and dizziness. What is the nurse's best action? A. Administer next dose. B. Hold medication and notify provider. C. Encourage fluids. D. Give atropine immediately. Answer: B. Hold medication and notify provider. Rationale: calcium channel blockers can cause bradycardia. HR less than 60 with symptoms requires holding the drug. Question 49. A patient on hydralazine therapy develops positive ANA titers. What does this indicate? A. Infection. B. Drug-induced lupus. Kidney failure. D. Allergic reaction. Answer: B. Drug-induced lupus. Rationale: hydralazine is associated with drug-induced lupus, often confirmed by positive ANA. Question 50. A patient taking propranolol for hypertension also has diabetes. What is the priority teaching? A. Monitor for increased urination. B. Watch for masked hypoglycemia symptoms. C. Increase carbohydrate intake. D. Avoid all exercise. Answer B. Watch for masked hypoglycemia symptoms. Rationale. Beta blockers can mask warning signs of hypoglycemia, increasing risk of severe unnoticed episodes.